Good evening, everyone. Thank you so much for joining us to learn about psychedelics for mental health. I am joined today. My name is Alec. I'm here to introduce our speakers today, as well as I'll hop back on at the end to moderate the Q&A. And I want to direct your attention to the chat, the questions, and the polls sections that we have at the chat in the top right here. From here, you guys can poll questions to our speakers, have questions that we've prepared for you guys just to learn a little bit more about you. And at the end, I will come back on to ask our speakers the questions that you guys poll. Without further ado, I would love to introduce Dr. Michael Verbora, who is our medical director in Toronto. And later, Dr. Ben Medrano will be joining us to share his perspective on psychedelic-assisted psychotherapy.
All right, thank you so much. And thank you everybody for taking the time to be here and learn and be educated and hopefully educate others a little bit about psychedelics. The most important thing about making psychedelic-assisted psychotherapy accessible is education. And when you're working with drugs that have a history of stigmatization, it's so important to communicate properly about the actual evidence around these drugs, because a lot of it is just misconceptions. So thank you so much for being here. Thank you for taking time out of your schedule to learn a little bit about psychedelic-assisted psychotherapy and field trip health. A little bit about me. I'm Dr. Michael Verbora. I'm a family doctor by training with a master's of business that I completed a number of years ago. I'm fortunate enough to be the medical director of Field Trip Health, and I also serve as a chief medical officer of Aleafia Health, a medical cannabis company. I'm an assistant professor adjunct level at McMaster University, and I teach a little bit about cannabis as well as psychedelics at Seneca College. So for those who aren't aware, we're really entering a very interesting time in the mental health field, and we're really at this transformational moment, and we're really entering a paradigm shift in the way that we approach mental health. And the truth is we have not had a ton of innovation in mental health for a number of years. We've had antidepressants now for a number of years, but it's just been Me Too drugs for the last 20, 30 years, for example. There has really not been breakthrough medications or transformations in terms of the outcomes, when compared to, for example, placebo. So right now, the approach to most mental health with pharmaceuticals is really emotional blunting. It's a very passive approach. It's take a pill every single day. This pill will adjust some of your neurochemicals, be it serotonin or adrenaline or other chemicals. And we're hoping that you feel better. And that's typically through suppressing how you feel about it. So you just feel the same way, but you tend to care less about it or think less about it. It doesn't necessarily allow you to kind of work through the actual issues that are at the core. Now, the shift is taking place because more and more research now more than ever, in addition to the fact that cannabis has become really mainstream slowly across the globe, but particularly here in Canada and in a number of states in the US, psychedelics are really this paradigm shift. And these psychedelics work completely different. It's an active approach. It's a tool that we can use when paired with psychotherapy to help break through the emotions or the pain or the suffering that lies beneath the surface, so that you can actually face the challenges that you or your loved one may have head on and grow from it. So it's extremely different than the current approach. There's going to be room for both approaches. It's not a one size fits all, but it's really nice to know that we're having innovation in the mental health space, particularly at a time when mental illness is really out of control and is such a contributing factor to morbidity and mortality across the globe. And let's be honest, the current pandemic doesn't help it. So what is a psychedelic? Well, if you just look at the definition of it historically, it's really just mind or soul manifesting or revealing. It's a temporary mental state under the psychedelic effect where you have an intense sensory perception. You can experience hallucinations, euphoria, and or despair. Not all experiences or trips can be pleasant, but they typically allow you to grow and have emotional release. So let's talk a little bit about psychedelic history, why it's so confusing, why there's so many perceptions and beliefs around it, and what the truth really is around psychedelics from a historical perspective. So there are actually hundreds, if not thousands, of different psychedelics, and the vast majority are probably synthetic drugs designed in pharmaceutical laboratories that have never really seen the light of day. And some people have encyclopedias of all these psychedelic drugs. But when you look at the most popular psychedelics, they typically come from nature. They have historical, spiritual, cultural use in certain countries or continents, or as well as religions or cultures. And they produce a wide range of effects, but primarily at the core of it is the sense of being able to elevate consciousness and promote healing. And that's a very big, bold claim, but that's historically how these drugs have been used. And so you can look at this map. It kind of illustrates some of the most popular psychedelic drugs, their history, when some of them have been synthesized. For example, LSD is a synthetic, and others drugs like ayahuasca, peyote, DMT, some of these come from nature. What's really fascinating about psychedelics, and what a lot of people are ignorant about, is that we actually have a ton of research on a number of psychedelic drugs, particularly LSD. LSD was made, by a Swiss chemist, and it was released for a number of research studies. And the effects were pretty much proven to be effective for a whole host of mental illnesses, particularly depression, anxiety, as well as maybe some addictive disorders. And it was actually shown to be relatively safe. But the 1950s slowly escalated. These drugs left very quickly the laboratory setting as well as the clinical research setting. It started to disrupt the social fabric of society, and they become regulated in a very negative way. Unfortunately, these drugs were Schedule 1 in the US and many other countries, and so that meant that they had no medicinal properties. So the actual research that was developed at the time went completely ignored, showing that there was efficacy. And once you're a Schedule 1 drug, it becomes nearly impossible to study these drugs. And so many of the psychedelic drugs are classified under this Schedule 1 drug, which makes it really difficult at times to study. This is a little bit of the history of it. This is the challenge when politics, doesn't like what it's seeing socially, culturally. Sometimes political policy won't necessarily match what the science shows about a drug, and that's the same with cannabis. Cannabis has never killed anybody. It's not 100% safe, but it's substantially safer than a lot of the pharmaceutical drugs that some of us prescribe every single day. But despite that, its regulation makes it seem like it's an extremely dangerous substance, which couldn't be further from the truth. Now, how are psychedelic drugs used? Well, historically, as well as today, they're used for a whole host of conditions. Primarily, there is a healing aspect around these drugs. There's a spiritual aspect. Sometimes they're associated with certain churches or religions. And there's also a recreational aspect, perhaps in the dance scene a little bit. But all of these really lead to extreme experiences. And the memory of these experiences is extremely therapeutic for people to have long term. But the most important thing, which we're going to talk about, is you can take the same psychedelic drug at the same dose, but in two completely different environments with two completely different mindsets, and have two totally different experiences, one being extremely pleasurable and one being extremely scary and fearful. And so the set and setting is so important when consuming a psychedelic substance. Here's a little bit more of the history of psychedelic drugs, and I'm just going to leave this here for those who are interested. It's a published study that kind of walks through some of the psychedelic drugs, some of the research around it, dating back to just before 1900 all the way to 2000. Okay, so let's talk a little bit about the most popular common psychedelic drugs. So as I mentioned, there's a whole host of psychedelics, many of which are synthetic. However, we're going to just talk a little bit about the most popular psychedelic drugs. Now, in the top right corner of this slide, hopefully you can see this is an unofficial way of categorizing these psychedelic drugs and how they work. There probably can be an evolution in this nomenclature with time. However, this is probably the best system that we have or at least that I know of to date. Level, we can call it 1 would be a serotonergic psychedelic. Second class would be empathogens or entactogens, which release serotonin. Dissociative drugs, cannabinoids, and others. So these are just different ways of categorizing how the principal molecule in a psychedelic is working on the brain or the nervous system. So let's just start with LSD over here. So it's a 1, which is a serotonergic psychedelic. So meaning it looks a lot like serotonin. It's going to bind like serotonin to your serotonin receptors. It is a synthetic designed in the lab. Hallucinations typically occur. Of course, all of these really depend on the dose, and the effects can last up to 12 hours. It does not appear to be addictive, and that's based on evidence that was collected, in the 50s, 40s. And 10% of the people in the US have admitted to trying this at some point, which is quite a remarkably high number. DMT is another serotonergic psychedelic. So again, looks and mimics serotonin, the happy molecule in our bodies. It naturally occurs in humans, plants, animals, and historically it's been used in the Amazon for spiritual purposes. It's the combination of 2 specific plants allow for the absorption of DMT through the digestive tract. It has rather rapid onset effects, and today you could fly to Peru and do a healing ceremony with DMT with a healer. Psilocybin is probably one of the most exciting molecules for me as a clinician scientist. It again is in that serotonergic psychedelic, that category 1, so it looks like serotonin. What's interesting with psilocybin is that it occurs in more than just one mushroom. There's different species. So it starts to look a little bit like cannabis in terms of the breadth of strains or varieties you can have. The psilocybin actually converts in the body to psilocin. It can last, 4 to 6 hours. Again, it depends on your dose, your experience, the set and setting. And again, it's been used historically for healing as well as spirituality. And what's really exciting about it is it's probably one of the most studied to date psychedelics in the last 5 to 10 years. So in the last 5 to 10 years on this resurgence of psychedelic research, psilocybin is probably at the top of the list in terms of new clinical evidence and new studies being pursued today. MDMA, some of you may know that as ecstasy or the rave drug. It's a little bit different. So it's an empathogen. So it's a different category of a psychedelic. And this releases serotonin. So it binds to certain areas of the brain, and then your natural serotonin releases into the synapses where it can bind and produce its effect. And these effects can last for a long time, 6 to 8 hours. It can be, depending on the dose, extremely energy intensive. And people will typically describe it as very heart opening. Okay. A couple other psychedelics I want to talk about. So THC, some people will argue that cannabis is not a psychedelic drug, but having treated thousands and thousands of patients with cannabis, I've met many people who've had psychedelic experiences with cannabis, particularly high doses of THC, sometimes intended, many times unintended or unintentional. I do believe THC is a psychedelic, mind you, typically more of a mild one. It binds to certain receptors in the brain and the immune system. What's really interesting about THC is its own class. It binds on cannabinoid receptors, which is totally different than the other types of psychedelics we've discussed. And what's really fascinating about THC is that it tries to promote overall homeostasis in the body, right? That balance in the body. But using the right amount and the right dose is probably an important feature. Peyote is a serotonergic psychedelic found in cacti typically. It's known as a divine messenger, and it's used by and has been used by historically indigenous communities around the world. And last but not least, and probably the majority of the conversation today will take place around ketamine, mostly because it's really only the legal psychedelic that can be administered today in most places. And what's really interesting about ketamine is that it's a dissociative drug. So it's an NMDA receptor antagonist, which is a complicated way of saying that it modulates mostly glutamate. It's been synthesized in the 1960s. We use it every single day in the emergency room. Children get this drug in very high doses. In the emergency room, it's deemed to be, relatively safe. Complication rates from ketamine are extremely, extremely low. So at high doses, it's an anesthetic. It helps, prevent pain and perception of certain effects. And what's really remarkable is for the last 15 to 20 years, we've known that certain doses of ketamine are antidepressive, probably anti-anxiety as well. And what also makes it attractive is it's not as long as other psychedelic drugs, which are 4 to 6 hours, which can be very intense. The effects are about 45 minutes to an hour, depending on the method of consumption. Okay, so what are the risks and safety of psychedelic drugs? So if you came to this world all of a sudden today and you found out that certain drugs were Schedule 1 or illegal, you probably would make the assumption that your consumption of them would be harmful. I think most of us would make that assumption. But in reality, we've studied this, and Professor Nutt in the UK, who is working and contracted for the government to do research on all drugs, legal and illegal, did this research study a number of years ago, and he was actually fired shortly after publishing the data. And if you look at the data, what he did was he found mechanisms by which to determine if a drug was harmful to the individual. So that could be your emotional, mental health, as well as your physical health, as well as how the drug impacted the people around you. So how it affected others around you emotionally, physically, for example. And I think by now most of us know that alcohol is by far the most dangerous and most harmful substance that one can consume. And if you look at its overall score, essentially a score of 0 to 100, 100 being the maximum possible, it scores around a 72, 73. Now, if you go all the way down the list, you can slowly start to see how certain drugs affect individuals when they consume them. And this is the blue bars, and then the pink bars are how the drugs harm others. And so what you can start to see is as you get lower and lower on this list, meaning that the drug is safer, all the psychedelics appear. So it's kind of interesting that alcohol can be purchased at a store, ordered online, delivered to your house, and it has all of these risks and harms. But psychedelic drugs remain illegal in many places, even though the actual physical harm, mental harm, as well as harm around others is substantially lower. So again, this is just evidence that the regulations don't match what the science shows about these drugs. And this is just from a harm perspective. We'll also talk about, from a benefit perspective, some of the clinical evidence. So when you take all those risks, benefits, and you put it all together, I've synthesized based on the literature, and this is a bit of an oversimplification because I'm classifying all the psychedelics together, and each psychedelic poses its own risks as well as its own benefits, but there's a lot of overlap. And so when we look at the potential benefits of using psychedelic drugs in the right setting, which is crucial, what we see is an enhanced mental flexibility. So you can define that as open-mindedness. And what we find is rapid antidepressive and anti-anxiety effects. And that's really crucial. If you're feeling suicidal, or if you're a clinician like myself and someone comes to you and they're suicidal, right now the only tool that people have is giving them an antidepressant and then hoping for the next 6 weeks before that drug really takes effect that nothing bad happens. And 6 weeks of feeling suicidal is a very long time. That's a hard ask for patients. And we know now, for example, ketamine is a rapid antidepressant. So within hours of using the drug, or within minutes, theoretically, you could feel the antidepressant effects kick in. And I have many colleagues who work in emergency rooms, in North America and around the world, who give patients doses of ketamine in the emergency room for acute suicidal behavior or ideation. What else is remarkable in terms of benefits for psychedelics is that it can really facilitate healing and trauma work. And it reprograms something we call the default mode network, which we'll talk about. Now, all drugs have risks and side effects. From a toxicity perspective, most psychedelics are non-toxic, meaning that you can consume them and you're not going to have like a liver failure, a kidney failure, a cardiac arrest, anything like that. There are nuances. If you combine certain psychedelics with certain drugs like antidepressants, there are increased risks. And so there are contraindications with some of the psychedelic drugs. But what are other risks that you have when you consume it? So some people do get anxiety, some people feel worried or panic. And part of that is, many believe is part of the healing process. Not all experiences are pleasurable. It's not, the perception I think a lot of, social culture has convinced us of, which is, you just hallucinate this beautiful experience. Sometimes that happens, but sometimes you do really deep, emotionally difficult work that is meaningful to your life, but it's hard and difficult. You get some subtle changes typically in your heart rate and your blood pressure, but at least from the data we've collected in the last, let's say, 50 patients or so, we haven't had any dramatic changes that have required too much intervention. And one of the issues is with most drugs, whether it's psychedelic, natural, or pharmaceutical, it takes a long time to learn what the effects are long term. So what's the right amount that you can consume over what period of time, and what are those long-term risks and the long-term benefits? And we don't really have those answers for a lot of drugs, right? And that's the same with pharmaceuticals, right? All the drugs come to market based on its evidence of efficacy, not its long-term data on safety, okay? So it's not until we do phase 4 studies, which is post-market surveillance, where the drugs have been on the marketplace, thousands, if not millions of people have used it, can we really determine what the risks and benefits are. Okay. So the default mode network was something I mentioned. It's a specific area of the brain that lights up when we're kind of in that daydream state. And we discovered this because we put people in functional MRI machines and we said, don't think of anything. And guess what? The whole brain lit up, okay? And so different areas of the brain light up in that mind wandering or rumination section. It's involved in the language and speech areas. It's probably part of our internal monologue. And what we find is psychedelic drugs loosen this default mode network. And a loose network has higher entropy, so more variable states. It's a higher level of consciousness. It allows for more creative and divergent thinking. And this is really the opposite of what we call a low entropy state, which people with addictions, OCD, very rigid thinking, and depression often have these very rigid states. And when the default mode network, the DMN, shuts off, people can experience an ego dissolution, which is just complete disconnection from, the pieces that identify you as who you are, and that can change. And that's helpful, right? Because if you are a very depressed person for a very long time, you identify with that person. And to shake that up, shake the snow globe up for a second, and to temporarily have far more opportunities to discover other potential identities for yourself is extremely, extremely therapeutic. The saying perspective is everything really fits with psychedelic drugs. They really give you completely unique, potentially valid perspectives on your life and your experiences. And this slide really illustrates what that looks like in your brain. This is a study of scaffolding of the brain and how the brain communicates. And you can see on a placebo drug, this is what most of our brains look like. But under the influence of psilocybin, all these areas of the brain activate, and areas that typically don't communicate suddenly start to communicate to each other. And that's what gives a whole fresh number of permutations to different realities, and perhaps change the narrative that many of us tell ourselves. And oftentimes can be very harmful to our own mental health. And so having that neural flexibility really increases the number of states of consciousness that we can pursue for our own healing. So let's talk a little bit about ketamine, the only legal psychedelic that you can administer in a clinic today. At least in North America. There's different legalities in different parts of the world. So it was invented because we wanted a safer anesthetic, because most anesthetics work by suppressing the ability to breathe. And if you've been paying attention to the opioid crisis, that's exactly how overdoses happen. It suppresses one's ability to breathe. And so that's how anesthetic drugs work, but you're usually with an anesthetist, and so they can breathe for you if that happens. But ketamine, you don't need that intervention. So you will not have that respiratory depression like you do with other anesthetic drugs. As mentioned earlier, we use this every single day in the emergency room. Animals also use it. In the Vietnam War, it was carried as what's called a buddy drug. So people would carry it on them, and if someone had a wound or an injury, or something happened that required a medical intervention, the guy next to you just gave you a dose of ketamine. That's how safe it was. Excuse me. You didn't need a medical degree to administer it. It works on a whole host of areas on the brain, particularly serotonin, dopamine, but glutamate is probably the most interesting molecule that it works on, and it modulates glutamate. In 2000, over 20 years ago, we discovered that it has antidepressive effects, but it hasn't really become an antidepressant until the last few years. Other research shows that ketamine can help with pain. So every day people get ketamine IV infusions for pain control. We also know that it works for depression as well as migraine headaches. There's evidence for that. There's also an approved ketamine nasal spray, which actually is approved in the US, and now it's just recently approved in Canada as well. It's an extremely expensive version of ketamine. Instead of generic ketamine, it's a specific enantiomer of ketamine. So just like the left hand and the right hand molecule, you just get one of them. And that allows for a patent on that. It's an expensive nasal spray, but has medical evidence that it treats treatment-resistant depression. And this ketamine drug works by dissociating the brain, meaning it just allows for temporary disconnection or suspension of one's thoughts. And that's probably what meditation is, right? It's getting to that state where your thoughts are suspended. Okay, this is the most important slide, clearly. This is just really a fancy slide for people who are really interested in how the brain is modulating different areas of the brain and what's happening on a neurobiochemical level. At the end of the day, this is more for scientists, but what's happening is certain molecules are being created which are neuro-anti-inflammatory, reducing inflammation in the brain, as well as promoting the proliferation of new brain cells or nervous cells or communications between brain cells. And so that's what we call plasticity. So the brain is becoming more plastic, kind of like a child relearning things or learning things for the first time. We can use psychedelic drugs, or for example, this is ketamine, to really give a brain an opportunity to learn again. So teaching an old dog new tricks. And you have a window. We don't fully understand how long that window is, but we believe strongly at Field Trip that having a therapist allows you to maximize that window long term, and that leads to changes, and hopefully good ones. So this is the scientific evidence and the studies around ketamine's neuroplasticity, so meaning that the brain's ability to change. And so I'll just leave this here for people who are really interested, and we'll also post this later on YouTube and everything if you want to go back and actually look at the studies. So I mentioned at the very beginning that we're at this paradigm shift, and it's still happening a little bit with ketamine. Excuse me. Ketamine's kind of being trapped between the old model, which is just take the ketamine and the ketamine will make you better, and a newer model, which is take the ketamine, but do psychotherapy, take it at the right doses, pair it with the right music, do it with intentions of looking inward, and try to heal yourself more long-term. So ketamine is really being trapped, and you see a number of different providers, around the world doing both of these versions. So the biomedical approach today is typically a ketamine infusion. You sit in a chair, it looks like a clinic, feels like a clinic. You get IV ketamine. You typically don't get a lot of dissociative effects, but you can. But they're usually trying to avoid it. And you sit usually by yourself. And after you're done, most people don't offer you psychotherapy or any customized mental health program to allow you to optimize that neuroplasticity. It's just very passive. The drug is going to do the work, just like we do with antidepressants, despite the fact that antidepressants were studied in combination with psychotherapy. So the effectiveness of antidepressants was really proven with psychotherapy combined. But today, I would say 95% of people just go on antidepressants and they don't do the psychotherapy component. Due to a number of barriers typically. And then the newer model, in my opinion, the better model is ketamine-assisted psychotherapy. So it's getting a ketamine through an injection or a lozenge. It's not shying away from the dissociation. It's actually leveraging it. And I'll show you on the next slides that dissociation is necessary, likely for outcomes. The experience is 40 to 60 minutes. We help people go inwards. We encourage you to close your eyes, put eye shades on, relax, take deep breaths, meditate, listen to specially curated music. Music seems to be synergistic to ketamine, and it activates some of the same areas as psychedelic drugs. And then afterwards, we provide therapy and we talk about what was your experience? What does it mean to you? How can you change your life to live a more meaningful life for you or for the people around you? And I think that approach is going to win in the long run. Despite that, there is clinical evidence for the biomedical approach. And for some people, that might be the approach that they prefer. And that's completely fine. It is an IV infusion. It's over 40 minutes. Here's a number of studies I've listed. It does show that the drug itself works. Okay, the effects typically last at minimum 4 to 10 days. Again, we don't have a lot of that long-term data. And a lot of people get lifted from depression. It can be very, very, very effective. And what do we see in the studies with the IV ketamine? Well, we see some blood pressure changes, some heart rate changes. People with high blood pressure, heart failure, or history of stroke shouldn't be using this drug. If you have, other effects such as headaches, nausea, vomiting can sometimes happen with this. And then there's obviously neuropsychiatric symptoms, drowsiness, anxiety, dizziness. There's a rare effect with ketamine, not just in IV, but in general. And we see this in recreational users. For whatever reason, there's a ketamine bladder disorder where people get inflammation in the bladder. I've never seen it in clinical patients who've used it properly, but I have met 1 or 2 patients who've abused it. Despite it not being, typically high drug of abuse, you can get this chronic bladder issue. And there is a little bit of abuse potential, but it's not nearly compared to drugs like tobacco or alcohol. So that's the IV ketamine. It's the infusion. I would kind of classify it in the older model. Still works, still can definitely help people, has good evidence behind it. And some people will gravitate to that and they will get benefit. And then other people like a new modern model, which is using the ketamine as a tool, but really the psychotherapy with the ketamine together is, supercharging the experience. And it's potentially going to give you more insight for longer term benefits. And so we use the psychedelic molecule to facilitate the psychotherapy. And what this is trying to teach people to access their own inner healing intelligence. And just like when you cut your arm or your hand and you have a small cut, the body sends, white blood cells and platelets and it heals. I fundamentally believe that we all have the ability to really help ourselves heal, not just our skin when we get cut, but some of our mental health wounds. And the problem is we just lose touch with what that healing message is. And for each of us, it's very unique. I don't think there's a one size fits all. So by doing these psychedelic drugs like ketamine, many patients will come to us during their experiences and feel like a light has been shined on the path that they need to take for their own healing. And no two paths are the same. But if we can help facilitate that, then I think that's what makes a good therapeutic relationship. I think that's really the art of medicine at its peak. How we do this ketamine-assisted psychotherapy is we prepare. Okay, so we don't just dive into taking ketamine right away. We're not going to just give you the ketamine on day one. We have to talk about your mindset and where you're at mentally and if it's the right timing. And then we eventually, move to giving the drug, and we have a number of sessions. And then after each session, you have the opportunity to talk to your therapist about what you experienced, to write in a diary about your experience. And then after every 2 sessions, we have just a mental health therapy session, an integration session, where we try to understand what those experiences are and how can we integrate it in the life that you're living so that you get the outcomes that you're looking for long term. Okay. And I mentioned many times now set and setting, and this has been shown numerous times that your environment and your mindset are so crucial to drug consumption. And this was really interesting, having learned so much from psychedelic drugs the past couple of years, and getting involved in this space, you almost kind of have to wonder if so many of the pharmaceutical drugs we take, especially the psychoactive ones, why some people respond and some people don't respond is really their mindset when they consume the substance, but also the environment that they're consuming it in. And so like I mentioned earlier, you can take a dose of ketamine in a certain environment and have a very negative experience, but then you can do it with the right intention, the right people around you, the right goals, and have a completely different experience. And so set and setting are so important. And that's why when we talk about Field Trip Health Clinics, we've designed what we think is a great environment to welcome people, to feel comfortable, to enter a new familiar space. Okay. So what is the evidence for ketamine-assisted psychotherapy? So this goes back to the 1970s from studies done in Mexico and Iran and even Russia, where through psychoanalysis and psychotherapy, they gave patients ketamine. And this isn't your randomized placebo-controlled trials. You're not going to get that when you go back this far in the literature, but it's just really interesting to know historically for the last 50 years, we've known that when you use ketamine and you pair it with psychotherapy, that there are therapeutic outcomes. And what's really remarkable is if you look at the data, a high percentage of patients were really doing well. So this actually should say 80%. I apologize, that's a typo. And then if you look at this one, 91 out of 100 patients did exceptionally well at certain doses. So that's 91%. Mind you, exceptionally well is not a great marker. And then this is a study done on alcohol and heroin dependence, and they were giving IM ketamine for 500 patients. And somewhere between 20 and 50% of people quit those drugs. Those are really hard drugs to quit. Those are some of the most addictive substances. So it's really interesting to see that we had a ton of research 50 years ago, but we never really grew on that research. And then this study came out. It's a relatively large clinical study looking at 3 different practices in the US. There's 235 patients overall, and they got either sublingual ketamine or intramuscular ketamine. And what they found is that the majority of people had significant decreases in symptoms, particularly depressive symptoms. And if you look at the subsets of the populations, people who were really sick, the sicker you were, the better you did, and the older you were, the better you did. So those were some of the interesting data that kind of got pulled out of the study. And so if you look at the depression scores, higher is worse. Okay. So the average score coming in before ketamine was 26.5 here, and 29 is very severe. So this is moderately severe, pretty close to severe. And then when people took their ketamine sessions, they dropped down on average to 15, which puts you into mild or minimal to mild. And then if you look at anxiety as well, average person had mild to moderate anxiety, and then they had minimal to mild. So this is just some clinical evidence showing that the lozenges and the intramuscular ketamine paired with psychotherapy has some evidence for effectiveness. What a lot of people ask me, particularly clinicians who I share the fact that we're doing this innovative and exceptional work with ketamine-assisted psychotherapy. One of the first questions is well, what is a trip like? Like, what is this journey like? Or what do people see or hear? What would I feel, see, or hear? And the first thing to note is that it's completely unpredictable. And not all doses, experiences are going to lead to these profound experiences. But yes, many people have mystical, spiritual, enlightening experiences. And no 2 experiences are the same. And again, what really matters is your mindset, the setting that you're consuming it, the dose, the team around you. All of those probably increase the chances that you're going to have a better outcome or a better experience. Now there's themes. So if you look at hundreds and thousands of patients who report data on their experience with psychedelic drugs, there's a categorization of themes that we can see. Many people will feel like they had a rebirth, so they actually visualize being reborn, and that allows them to reinvent themselves or reinvent the narrative that they're telling themselves. Many people have the experience of dying or a near-death experience, and so that also tends to help with existential anxiety. And there's studies with psilocybin showing that just 1 dose of psilocybin in terminally ill cancer patients can reduce their end-of-life anxiety remarkably. So not being afraid of death can be so therapeutic to people who are severely ill. People say that they have the dissolution of the ego. So their ego tends to dissolve. They lose touch with who they are temporarily, but that allows them to kind of wonder the pieces that make them up and have the ability to change some of those. We get mystical experiences, spiritual awakenings, religious experiences. And some of the common themes is people will say sometimes some of the more common things like, I really need to exercise, or I really need to spend more time with my family, or I need to just tell my kids I love them more often. And it sounds so intuitive and so common sense, but when patients who undergo psychedelic experiences tell you some of these common sense things, it's like the light was shined onto it, and they realized how important it was, and how much the fact that they weren't engaged in these activities was contributing to their depression or their anxiety. So you can tell a patient a million times to do something that's good for their health, but it's not until that light bulb goes off. And that's what psychedelics do. It helps that light bulb go off. Okay. A lot of people are scared about, especially in the medical community, they don't like the idea that ketamine produces like a high or a psychoactive effect. It's the same thing with THC. Many people, steer away from THC because it produces a change in your consciousness. And well, the more difficult the problem is for an individual, the more likely they're going to have a therapeutic outcome if the experience is one of elevating consciousness. So if you don't need to change your consciousness to feel better, then perhaps don't do that. But the deeper the problems, the higher the level of drug effect and conscious altering it needs to be to get that meaningful of a response. So I struggle with the medical community. They're so fearful of this, and it's like, as long as it's not toxic or harmful or addictive and it's done in the right setting and it really is therapeutic, I don't know why culturally we're so shy about enhancing our consciousness. And really it's one of humanity's great opportunities, is to constantly educate or experience elevated states of consciousness, and to collectively, the more that we can do that, the more that we can live better lives for ourselves, but build better communities, a better world, a better system that helps the majority of us. So elevating our consciousness is just so important, and I really struggle with why we're shy, or we shy away from it. And what's really interesting is some companies want to take away that effect, right? Pharmaceutical companies have been trying to work with ketamine and make it non-dissociative, and they've poured millions of dollars into it. And what they found is if you take away the dissociative effect, you just don't get the medicinal outcomes. And there's studies out there, and I've listed them here on this slide, that show the dissociation is directly correlated to the clinical outcome. So I don't think we're going to be able to get away from dissociation or psychedelic effects if we want meaningful outcomes. Okay. What else is taking place in the research? So I'm going to leave this slide here. And for anybody who knows about MAPS, you can Google MAPS, the Multidisciplinary Center for the Studies of Psychedelic Drugs. They're doing a ton of research, and they have a whole list of research on their website. But it's so fascinating, and it's so exciting for once to see innovative drugs being studied for conditions that we don't have good treatments for. We have a whole host of treatments for a whole host of conditions, but we really throw pharmaceutical drugs like SSRIs, we really throw them at a lot of problems, even though the evidence might not be there for them. And for example, that could be PTSD or eating disorders. Like, we sometimes struggle using certain drugs to help those patients. And it's nice to know that there's very, very promising early studies showing that we might be able to really help cure people with traumas. And that's really exciting to me, because right now it feels like the tools that I have as a physician are quite limited. So what does the future look like? Well, in my opinion, the future is going to be something like this. We're going to see, protocols developed and people trained in certain protocol delivery of drug plus a certain therapy. And so maybe the therapies will change depending on the disorder or the disease that an individual has, and the drug will also change, but it's going to be the combination of them that's going to help with the certain condition. Okay, so I'm going to just switch gears at the very end now and talk a little bit about field trip health. Okay, excuse me. I guess it's very dry in here. So what is the problem that field trip health is trying to solve? So we realize that one, mental health illness is growing, and the current treatments really don't work for a lot of people, a big percentage of people. And we know that you can take one antidepressant, and if it doesn't work, the chances of the second, the third, the fourth, the fifth working, the chances just diminish. And eventually, after you hit the third or the fourth drug, the chances of a new antidepressant working is extremely, extremely low. And we know that the window of relapse is quite quick. And the other thing is, it takes a long time for antidepressants to kick in. It takes 6 weeks. So there's populations like acutely suicidal patients, where antidepressants might not actually be the best option today. Ketamine might be the very best option for suicidal patients, because it works rapidly. And here's the data showing, as you take more and more antidepressants, the probability of it working just decreases. So this is the relapse rate. So you can see, by the time you get to your second, third, fourth medicine, your chances of relapsing just continue to increase. So it's not, it becomes evident to me that it's not really getting at that core issue. It's masking it. And again, that's the new paradigm versus the old paradigm. So this is what, the entrance to our Toronto clinic looks like. And these are some of the clinics that we have. And Toronto, New York, LA, Chicago, and many more being open simultaneously. This is a room, this is the space. So patients who are approved for the therapy and they do their ketamine will come into a room like this. This chair goes all the way backwards. It's called the zero gravity chair, allows you to feel as comfortable as possible. We provide weighted blankets so that you feel comforted. We give you headphones with specially curated, psychedelic music that really complements the experience. And we have a therapist in the room with you, and you wear eye shades the entire time. And we really do our best to stick to that protocol. Our program was developed by a number of, renowned psychiatrists who, have scanned the literature to determine the right dosages and the right protocol. And so we do this 2 times a week for 3 weeks, paired with integration sessions. And we really believe in the process, and we let patients have their own experience. If they want to talk, we talk. If they want to, close their eyes and go completely inward, which is what we encourage the most of, we allow them to do that. And then we can talk afterwards about what that experience was. So we really try to maximize that hour of ketamine plus the set and setting. And you can see that the space is obviously designed with great intention. So this is the protocol for a new patient to go through a psychiatric consultation and make sure that they qualify for the ketamine, that there's no reasons why they shouldn't use it. Then they have to go through preparatory sessions with our psychotherapy team. Then they go through treatments, and then they integrate the experiences of their treatments, and then we follow up beyond. So we know that, mental illness is a lifelong issue for all of us, and that it affects everybody at some point in their life, and we're all on different journeys. So we want to be there for you long term. And so we send questionnaires out to check in to see, what are you doing 3 months after you've graduated from the program, 6 months, 12 months. And then sometimes people will come in for a booster session or 2 sessions, and we'll do that with the therapy as well to kind of try to get them back on their feet again a little bit, or give them that boost. Okay, so this is what the process looks like. We have the psychiatric clearance, then a medical clearance. We either use injections or tablets. In Toronto, we're using tablets, but in New York, in LA, we're using injections. It works a little bit faster. There's just different regulations in the countries and provinces and states. We have a sitter, which is a therapist present, and then we integrate the experience after every 2 sessions. And then as needed, we do these booster dosings. Okay, so what is the data that we've had? So I'm just going to kind of show you a little bit of our data. So we have slightly bias towards men, just over 50% men and just under 50% female in our program. Average is 42 years old age, and this is our Toronto data. And this is just some data on the last number of, let's say, 50-ish patients. We took the data at the different dosages. So we start at a low dose and we customize it. It's not one size fits all. Some people will tell me I'm very sensitive to drugs, so we approach it more cautiously. And other people will say that they've always needed higher doses of drugs to get effects. So we really listen to our patients and try to understand where we think they should start and how they should progress. And what's really remarkable is the green bars are no side effects. So you can see, even as we increase the dose, there is obviously a slight increase in side effects, but the vast majority of people don't really report any side effects with ketamine, which is really remarkable for such a potent experience in drug. Some patients will get dizziness, it goes away. Some people get elevated blood pressure. Some people can get a headache, a little bit of weakness or fatigue, but all of those symptoms go away. So what's really remarkable is that the effects or the side effects are extremely low. And then if you look at the outcomes, this is what the data we have on our patients. So this is real world data, which I find valuable, not just research data. So the average patient pre-treatment is coming in with a depression score of about 17. And this is on a scale of 0 to 27, 27 being the absolute maximum. So after a number of doses, we can see that they're dropping down significantly. Okay, so this goes from depression to not depressed. And then after the treatments are finished and we've done the integration sessions, this goes from depressed, not as depressed or not depressed, to living life with meaning. And that's the scale that we're looking for. This is why we've designed these clinics, is to make this dramatic difference in people's lives. And if we look at anxiety as well, this is a scale that goes from 0 to 21. Most people come in with mild anxiety, and we'll see here the same effects as we see with depression. We see massive decreases during and post-treatment. Okay. So what are patients saying? This is the one space where hearing patient stories, that qualitative data, is what just inspires me and inspires our team so much to keep doing what we're doing. And some of the stories that we get from our clients are just so moving and so motivating. And we meet every single week, and we spend hours talking as a team about our clients' experiences and understanding what they're sharing and what they're learning about themselves and about their experience with life, because it's just so rewarding to hear people, you know, who often feel like there's no hope, live again. And I don't know, there's no better job that I could have than to be a part of that. So patients have told us things like, you know, I feel like I have direction now for the first time or in a long time. And I understand what I need to do for myself to feel better. You know, for the first time in a long time, I actually feel happy. The brain fog that I've had has lifted. And this is a story that was published in an article from one of our clients. I can't explain it, but I can tell you it was the most productive therapy session of my life, she says. Although I had previously been aware in an intellectual sense of the traumas of my past, I never accepted or even understood how those events shaped and damaged me, making it impossible to form healthy relationships. The ketamine had somehow given the intellectual knowledge I had emotional resonance. I cried like a baby for the first time, truly understanding how the events had damaged me. I could also see that every action in my present was linked to a huge amount of baggage from my past. Like, that's just such exceptional insight to be gained in, you know, just 10 to 15 hours of commitment over a couple of weeks. That can take 5, 10, 15 years sometimes, or never, in terms of therapeutic time. So this is really putting therapy on steroids to really help accelerate the healing process. And so to be a part of those conversations with patients is an extremely rewarding part of my job. Here's a little bit of our team. You know, we have exceptional psychiatrists on our team, medical advisors who've helped develop this program. And then I'm going to leave you with some links, some resources. And if you haven't read Michael Pollan's book on how to change your mind, if you're new to psychedelics, I read this a number of years ago. I read it, I think, in about 48 hours because it was such a page turner and I couldn't put it down. And I knew as I was reading it that I wanted to commit the next, 50 years of my medical career to helping people heal. And I felt like in medicine, we were really losing touch with it. And it was such a motivating book that I'm so blessed and fortunate to be here today to actually be doing, what I'm aspiring to do. So really thank you all for being here. Thank you for taking the time to learn a little bit, and we'll open it up for questions. And I'd also want to make sure we introduce Ben Medrano, our medical director in New York as well, because he's got a remarkable story that hopefully he can share.
He does. On that note, I would like to invite Dr. Medrano on stage. Thank you so much, Dr. Verbora, for your insight and your bird's eye view into the history of psychedelic medicine as is. Dr. Medrano, please take it away. We'd love to hear a bit about your story and how the New York clinic works to promote lasting healing in your environment.
Hi, everybody. Can you see and hear me?
Yeah, we're good.
Okay. Hello, I'm Dr. Ben Medrano, and I'm the medical director out here in New York City. And how much time do we have? I don't want to bore you with my life story, but I'll give you a little detail. We've got a little bit of time here. So I grew up in a family with a lot of people with mental health challenges, and that actually is part of why I am where I am today. I have close personal experience with all the challenges that come from not just the mental illness itself, but navigating the mental health care system. And that actually was tough growing up because of that. And it actually led me to do my own exploration in my teens. And so I'm an out and open psychonaut. I had tried basically every common psychedelic under the sun in my teens. I was a raver in the 90s, back in the Chicago rave scene, and I wear that badge with pride because that period of exploration for me was very healing. It actually led me to start meditating. For one, it made me think, maybe I can actually obtain some of these, beautiful states of empathy or peace or oneness that I have with these substances. Maybe I can obtain them, without the substance. And so I dove deeply into meditation, and particularly from a Buddhist perspective, and led me down a long road of going to Buddhist seminary and becoming a close personal attendant to a Tibetan Buddhist teacher and best-selling author, and traveled the world, ended up in Tibet. And at some point I decided, I gotta pay the bills. And so I ended up going back to school and becoming a psychiatrist out of inspiration for all the things I'd learned from psychedelics and consciousness and Buddhism in general. So for me, this is a long trajectory towards my dream job. So I'm really happy doing what I'm doing here. I'm so happy that Field Trip exists. And it's just been a beautiful experience to see patients getting better so quickly, and at least accessing states that they couldn't access before, and growing from there. So our clinical model is pretty much the same as what Dr. Verbora mentioned. We use intramuscular ketamine, so just a different route of delivery, but ultimately you get the same result over a little bit of a different time period. But aside from that, we're doing all the same stuff. So I think maybe I'll just open it up to see, where to go from here, like what questions there may be or so on. Maybe Alec could give us some guidance.
Thanks. Thanks, Dr. Medrano, for sharing your story.
Yeah, of course.
Yeah, I'm happy to hop back on here and ask you guys the questions that we have in our audience right now. So the first question that has not been answered by Dr. Medrano. Dr. Medrano was the one who was furiously typing onto all of your questions.
Oh, my fingers.
Yeah, he's giving you a very good finger workout. How/what is Field Trip doing, if anything, to address barriers to access, including financial barriers and cultural BIPOC barriers?
I love that question. I love that, it seems like there are so many big hearts that get into this work. And I can relate to that question. That was actually one of the first questions I asked when I started working with Field Trip, like, what is our long-term plan? I think first and foremost, in my opinion, so maybe I'll just take a few steps back. So I trained in med school in a special track called the urban underserved. And my goal was to actually address this issue just from basic mental health care in general. I chose to come to New York City specifically to work with the underserved, to work with a diverse population, and I do not regret that decision. It led me to working in assertive community treatment, which is the trenches of mental health care. Like I go into NYCHA housing. I still actually do a little bit of this work. Going into NYCHA housing and working within the community and meeting my patients where they're at, giving them their medications, or just trying to help them in whatever way I can. That inspiration is carried into this work. And we've spent a lot of time thinking about, well, how do we increase access? And we realized, well, we need to build the industry first. It's an industry that doesn't even exist. So first you have to make sure that there's the infrastructure before going straight to figuring out like how do we increase access through, working with insurance and so on. Right now, ketamine is not covered by standard insurance. And so what we need to do, at least here in the United States, is figure out, skillful ways of giving billing codes to people so that they can get maximal reimbursement if they do get out of network. But the next step, I think, for us is to start coming up with novel funding models. And we haven't really sort of pinned down a precise plan for that yet, but it's an ongoing conversation.
It is an ongoing conversation here with many different moving parts to it. Dr. Verbora, do you have any thoughts as to how our Toronto clinic is also tackling this?
Yeah, we do our very best to meet patients where they're at, and I know a certain percentage of what we take in, we do try to donate back to patients who can't afford it. Some of it is conventional, so the therapy is still conventional. So if people have insurance or coverage, about half the program can be covered, which is at least a little bit helpful financially. But yeah, we get it. There's a lot of barriers. But what we're hoping for is with more and more patients coming into our clinic, and I can get bigger and bigger numbers on that data, at some point, employers and insurance companies, when they meet to discuss their insurance plan, if you can start to prove the economic value that $2,000 to $5,000 of ketamine treatment over 3 to 4 weeks is better than 3 to 4 years of therapy. If you can get that data, and that 3 to 4 years of therapy costs $30,000 to $50,000 and has increased risks of disability at work and absenteeism, for example, once you can get that data, I think it's going to be a slam dunk, and I think the accessibility will increase. So it's a chicken and egg thing. You need a little bit of the commercialization, you need a little bit of the data capture, you need the research and the investment to kind of get to the point where we can actually make it accessible as well. So I appreciate the comments, and we have to find a fine way of balancing them all, and that's challenging. And I know at Field Trip, as a publicly traded company, we value, not just what we take in financially, but our people and the planet as well. So we subscribe to the 3 Ps of profit, people and planet included.
And the one thing I will add to this is that the good people at MAPS have actually been doing a lot of work looking at funding models for when MDMA comes to the market. And they've actually come up with a cost-benefit analysis that shows that a few doses, 2 to 3 doses of MDMA within the veterans population could save at least $1 million per person, is what I remember reading. This was a while ago. And I think that's reflective of the treatment model that we have as well in terms of pricing structure that they're pitching. But the other part of the question about barriers for BIPOC clients. So I think that needs to be addressed from the ground up just by looking at simple things like staffing. So we've put a lot of attention into trying to diversify our staffing at our clinics, and we're continuing to build in that way, but we hope to have a broad representation and backgrounds and culture and ethnicity, so on.
Well said. Thank you both. Why don't we move on to the next question, which is, can anyone counsel or advise a New York State resident anxious to find a way to participate in psilocybin therapy for depression? I think this answer might be a little on the shorter side because of the legal structure right now. And so yeah. I think that could be where that question begins and ends. But.
Yeah, there's a quick and easy answer to it. It's illegal. So we can't like, can anyone, I assume you mean like a clinician. No, we cannot recommend anybody to do illegal substances. And that's just an unfortunate state of affairs. I imagine that's going to change pretty soon. And it's already changing like state by state with, at least starting in Oregon, within a couple of years, there will be the infrastructure for psilocybin to be used clinically. For now, we are given permission, essentially, and this is just from counsel from various lawyers that I've talked to in this field, that state that we can promote harm reduction and integration services legally. So what does that mean? That means actually if a patient comes to you and says, I'm thinking of doing a psilocybin journey, and so you just start with educating them on the research around it, safety measures around it, and then also saying, okay, well, just to be safe, you're taking these medications and advising against, if need be. If they do end up taking the psychedelic, then we are allowed to give integration therapy, not during the experience, but afterwards. So if they, on their own volition, decide to take a psychedelic, they can come to you later and they can actually use it therapeutically in discussion with you. Not use the drug, but use the experience, that is.
Yes, there's that fine line there. I think we can end on one more question, and then we'll deliver some quick closing remarks. But I think this question could incite a very interesting discussion, and that question is, what advice do you have for activists who want to advance the Psychonauts agenda and bring psychedelics into mainstream life?
Join Chacruna. So if you Google Chacruna, CHACRUNA, it's named after one of the components of ayahuasca. They are involved at all levels of advocacy. So I would start there.
Yeah, I would just add, from a clinical perspective, I think, I'm supportive of that. However, we have to be cognizant of what led to rapid regulation of psychedelics, 50, 60, 70 years ago. And because they kind of left the scientific field just too quickly before we could capture the data, even if we know intuitively that they're relatively safe and that they can help, I think most of us here know that intuitively. We have to get that data out there to convince the people in power and a lot of the power structures out there. And I'm just worried that if we kind of are a little bit cowboyish here and this renaissance happens a little bit too fast outside of a clinical scientific setting too quickly, like I just worry, people are going to be heavy-handed and come down with the stick hard and make a lot of them illegal again. So I think we got to find that balancing act. But look, as I mentioned in my talk, I'm extremely supportive of individuals learning to elevate their consciousness, whether it's through meditation or exercise or deep breathing or through psychedelics or the combination of them. I'm very supportive of that culture. So I think we're going to get there. I just think we have to be patient in that pathway, just to not slow it down unintentionally.
Absolutely.
I think that was extremely well said and a very good place to end. I want to thank everyone for coming. I want to thank our presenters, both for delivering an amazing talk in the first 45 minutes and for furiously answering questions in those 45 minutes. For everyone who has tuned in worldwide, thank you so much for joining us today to learn about psychedelics as they help treat mental health conditions around the world. If you would like to get in touch with any of us, we are available via email at hi@fieldtriphealth.com. You can also visit our website, www.fieldtriphealth.com, to learn more. And we are really looking forward to hearing from you and continuing the discussion on how psychedelics can be used to heal mental health conditions around the world.
Thank you, everyone.
Thank you, everybody. Take care.